This video is in the nature of a public service announcement. Well, hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with MS for over 40 years. I saw an article today that because it reflected something of my own experience, I thought I'd share with you. I don't know how many of you are using Copaxone or thinking about it, but this is timely information, so let's take a look. I saw this article in Multiple Sclerosis News today. It was published on September 2nd of 2025. Health Canada warns of severe allergy risk with some MS products. Warning follows 14 cases of anaphylaxis tied to use of glatiramer acetate, which is Copaxone. Health Canada is warning that glatiramer acetate products used in the country to treat relapsing remitting multiple sclerosis may cause a severe allergic reaction called anaphylaxis, which can be life-threatening. The warning follows 11 reported cases of anaphylactic reactions linked to Copaxone, the original brand name of glatiramer acetate, and 3 reactions from other glatiramer acetate products. That's according to an agency press release stating issue health products, product safety, new safety information, which has this warning: if you experience anaphylactic reaction symptoms, stop taking glatiramer acetate and seek immediate medical help by calling 911. Do not restart taking glatiramer acetate unless your healthcare provider has identified another clear cause for the anaphylaxis. And those symptoms, I hope they're going to go into them a bit more. I will not say anything yet. Let's wait and see if they do. The Canadian prescribing information for Copaxone has already been updated to reflect this new safety risk, and Health Canada is working with other manufacturers, including the makers of Glatact and Mylan glatiramer acetate injection, to update their respective labels per the agency. Patients using glatiramer acetate who develop symptoms such as difficulty breathing, swelling of the face or throat, dizziness, or a rapid drop in blood pressure should seek emergency medical care immediately, according to Health Canada. These reactions can occur at any point during treatment, from as soon as patients receive the first dose to after months or years on the medication. Symptoms generally appear within 1 hour of injection. In light of this warning, I have to consider that this is a little interesting that in April of the same year, 2025, they had this article: Copaxone appears safe for use in pregnancy breastfeeding study. Okay, so your baby might die of anaphylactic shock, but it's safe other than that. Don't you worry about a thing. While no fatal cases of anaphylaxis have been reported in Canada, some patients require treatment with epinephrine and other medical interventions, per the agency. Epinephrine injection, commonly known as EpiPen, is the first-line emergency treatment for severe allergic reactions. The regulatory agency has already informed healthcare providers, including neurologists, emergency room physicians and staff, nurses, and pharmacists, about these safety issues. Glatiramer acetate sold as Copaxone in other products for MS. Healthcare providers are advised to inform patients about the symptoms of anaphylactic reactions and note that symptoms can be similar to immediate post-injection reactions. Such reactions may occur shortly after injection and spontaneously resolve within 15 to 30 minutes. Anaphylaxis symptoms, however, are typically more severe and worsen over time. Patients should also be instructed to seek immediate medical care if they experience symptoms of anaphylaxis, and to discontinue treatment if an anaphylactic reaction occurs. The therapy shouldn't be restarted if the reaction is confirmed to be related to glatiramer acetate. This safety information was prepared by Health Canada in collaboration with Teva Canada Innovation, Copaxone's developer, and is being communicated to healthcare providers and Canadians via the Recalls and Safety Alerts database. It will also be distributed through an email notification system. In a section titled What Healthcare Professionals Should Do, the public advisory says clinicians should inform patients and/or caregivers of the signs and symptoms of anaphylactic reactions, which may overlap with those of an immediate post-injection reaction. New boxed warning of allergy risk also added to U.S. product labels. In the U.S., glatiramer acetate products, including Copaxone, are approved for relapsing forms of MS, clinically isolated syndrome, relapsing remitting MS, and active secondary progressive MS. Earlier this year, the U.S. Food and Drug Administration also added a new boxed warning to the labels of glatiramer acetate products after identifying 82 cases worldwide of anaphylaxis related to the medication. So maybe you are wondering, what is anaphylaxis and anaphylactic shock? I've got a short video that will explain it a little better, just in case you don't already know.
In this video, we'll talk about anaphylactic shock. Anaphylactic shock is one kind of life-threatening severe allergic reaction, and it happens due to immune system's release of certain chemical in an uncontrolled fashion. In anaphylaxis, blood pressure drops and suddenly the airway becomes constricted, which leads to difficulty in breathing. The pulse becomes weak, the heart rate becomes rapid, there is a nauseous feeling and blister-like rashes throughout the skin. The immediate treatment is an epinephrine injection followed by a visit to emergency room, because anaphylactic shock can relapse within 12 hours. So let's say, what can cause anaphylactic shock? So there are certain food items, such as let's say seafood or let's say insect sting, that can possibly cause anaphylactic shock. Other than that, there could be certain drug or let's say anesthesia-induced anaphylactic shock as well. So let's talk about the immunology underlying anaphylaxis. So there are cellular and molecular components which are associated with anaphylaxis. Majorly mast cell, basophil, and IgE antibodies are associated with the anaphylactic reaction. It's also a type 1 hypersensitivity reaction which is rapidly occurring. Now, it starts with the exposure of allergen one time, the first exposure. At that point of time, the dendritic cell would present this antigen to the T cell, which would eventually proliferate and differentiate into Th2 subtype. Eventually, Th2 subtype secretes cytokine that converts naive B cell into plasma cells that produce IgE antibodies. Once IgE antibodies are produced after allergen exposure, these IgE antibodies can bind to the mast cells with the Fc receptors, and thereby they sensitize the mast cells for future. This was the first exposure. So after first exposure, there is no visual symptoms, nothing happens. But the problem occurs when there is a second exposure. During the second exposure, the allergen binds to the IgE cross-linked receptors and lead to severe degranulation of mast cells in an uncontrolled fashion. These kind of degranulation can cause several things, most commonly bronchoconstriction. When the airways are constricted, it's difficult to breathe. Less oxygen goes to different parts of the body. Then there is increased glandular secretion, smooth muscle constriction, and vasodilation. Dilated vessels ensures more and more immune cells to move to the regions and cause inflammation. Anyway, treatment of anaphylaxis includes epinephrine shot in the thighs, followed by a visit to emergency room, because it can relapse within 12 hours of time. So constant monitoring is really important when somebody is undergoing anaphylaxis. Anaphylaxis is life-threatening. So if somebody is undergoing this kind of situation, they should immediately rush to the hospital. Otherwise, there could be a problem.
And then you might want to ask your doctor about EpiPens and whether you should be carrying one with you, just in case.
Epinephrine is the first line of defense to treat anaphylaxis, and the sooner the reaction is treated, the less severe it's likely to become. People with severe allergies or a history of anaphylaxis should carry an auto-injectable epinephrine pen with them at all times. Epinephrine typically comes as a single-dose, pre-filled automatic injection device, commonly known as an EpiPen, and is designed to be injected into the thigh. This training is based on the EpiPen brand of auto-injectable epinephrine. So if you use a different brand, make sure you follow the manufacturer's directions. Anytime an EpiPen has been used, make sure 911 has been called. The person must seek immediate medical treatment, even if they feel better. Now, to administer an EpiPen, remove the safety cap. Grip the EpiPen in your hand with the tip pointing downward. Never put your thumb, fingers, or hand over the tip. Firmly push the tip into the person's outer thigh until the pen clicks. The needle will go through clothing. Keep the auto-injector firmly pushed against the thigh at a 90-degree angle. Hold it there for 3 seconds. Pull the EpiPen straight out of the leg. Make sure not to pull out at an angle, as this could cause a lot of pain and bleeding. If blood comes out, the drug may also come out and reduce its effectiveness. Rub the area for about 10 seconds just to help drug absorption within the muscle of the leg. A second EpiPen may be administered if the symptoms continue or recur and there's a delay in EMS response of more than 5 to 10 minutes. The person will often feel relief from the tightness in the throat or airway fairly quickly. It's often normal for the person to experience side effects from the epinephrine. They may include a fast or pounding heart, shakiness, feelings of anxiety, dizziness, and a headache. Once an EpiPen has been administered, make note of the time it was used if possible, and be sure it's given to the medical professionals upon their arrival.
Well, let me tell you a little bit about my own experience with this whole thing. I was on Copaxone for about 10 years, and I had been taking it regularly for I don't know how many years, but several at least. And then one morning after my shot, it was probably within, I don't know, a few minutes of my shot, I got what I now understand was an anaphylactic reaction. My throat started to close up, and I could tell that my heart was pounding, and I felt kind of hot, I think, as I recall. It did not last very long. It was kind of scary at the point because I'd never had that happen to me before in anything, because I'm not allergic to bees or food or anything like that. So I'd never had that reaction to anything before. But it did not last very long. I would say probably 30 seconds to a minute, and then it was pretty much resolved. But I did go ahead and make an appointment with my neurologist, which fortunately he was able to see me pretty quickly. And I think it might have even been the next day. I went in to talk to him about what had happened. And his reaction was kind of interesting. He wasn't a very dramatic guy. He didn't get overly excited about stuff. So when I told him about it, he said to me, "Well, didn't you read the pamphlet and all the list of side effects that you might get? Because it's listed right on there. So it's normal." And I said, "Well, you know what? It may be normal, but it's not normal for me since I've been taking this for years and I've never had this before." And he stopped and thought about it for a minute. And he said, "No, you're right. It was good that you came in. That was the right thing to do." Okay, but what advice did he have for me? Nothing really. So I went on, and over the next few years, I had that reaction again. Oh, I don't know how many times. I'm going to say maybe 4 to 6 times over the years. Not often. I guess I just assumed you didn't have to think much of it because the doctor didn't seem particularly concerned about it. Should he have been? Well, I don't know. Given the article that we read, maybe He should have been. Thankfully, I didn't have any of the complications and the recurrences that they talk about. And I just powered through it, which I have a tendency to want to do anyway. And it all worked out. But I guess my concern for people is that they may not be aware that this can happen. Let's hope people with MS who are taking Copaxone are more informed about the possible anaphylactic reaction than I was, and what that actually was, and how serious it could be, because I didn't know any of that. And so I'm providing this video and the information mainly so that if it may be of help, hopefully, for someone who might need it. And it might not just be Copaxone that would make you have this reaction. For all I know, something else that we take for MS could cause this. It's probably just as well that you're aware of what anaphylaxis is and how serious it can be. I'd like to hear from you. Have you had any experience with anaphylactic shock? Have you been on Copaxone? Have you had that reaction? How serious was it? Hopefully it wasn't any worse than mine, but I'd really be curious to know. But that's all I have for you today. So until my next video, oh, do take really good care of yourself. Pay attention to everything different that's happening in your body. Don't ignore it, because it could be more serious than you want to think it is. I will see you again soon.